82. So it's a little bit higher. Then it goes down in adolescence and adulthood, and then the elderly, greater than 200 per 100,000. I have a kind of a graphic. So this is the incidence of epilepsy. So you can see there's sort of a peak early on, and this is because babies that are born with birth defects or have intracranial bleeding at birth or encephalitis or something that injures the brain are likely to have seizures. And then in middle life, if nothing bad happens, you're okay. And then as you get older, the big problems are stroke, brain tumors, infections, and actually neurodegenerative disease like Alzheimer's disease is also associated with the development of epilepsy or seizure disorder. Seizure disorder, those two words, and epilepsy are synonyms. Many people will say, oh, he doesn't have epilepsy, he has a seizure disorder. So that's really not correct. It's just a way of saying something they don't want to admit that they have epilepsy. But it's the same thing, so you should not be confused by that. A seizure disorder is a disorder of recurrent seizures, which we defined as epilepsy. So I think this is a high number, but this is the number in the book, that if you make it to 80, you've got a 3% chance of developing epilepsy for one reason or another if you take everybody in the world. Well, what's interesting about epilepsy is that even today with CT, CAT scan, and MRI of the brain, that more than half of the cases we still don't know exactly what is the cause. The causes depend a little bit on age, as I was stating earlier. Genetic infections, malformations, perinatal injury you're going to see primarily in children, and then elderly, stroke, and Alzheimer's. Traumatic brain injury, obviously motor bike accidents, motor vehicle accidents. If you have a skull fracture, if you have bleeding, subdural hematoma, if the brain is severely injured, one of the consequences of that is often epilepsy as part of the healing process. And there's a relatively new disorder, autoimmune disease, in the brain with antibodies to neurons that can cause epilepsy, but this is very, very rare. I'm not sure if you can see all the fine print, but the point of this slide is to emphasize that the big yellow part is the ones that we don't know the cause. But what we suspect is that a lot of those are genetic. Very often, if you talk with someone who has a seizure disorder and you say, does anyone in your family have epilepsy? The answer is, well, yes, one of my cousins or tita or somebody somewhere in the family has a seizure. So it's not autosomal dominant necessarily or autosomal recessive where you can predict. But so we think it's, for those of you interested in genetics, that it's a multi-genic, multifactorial disorder in most cases. A lot of research in epilepsy now is to try and figure out, well, what are these abnormalities? For example, if you look over on the right, one of the new categories of things that can cause epilepsy are ion channel defects. That there's an abnormality in the sodium channel alpha subunit called SCN1A, and that can cause Dravet syndrome. And so you can actually test for that now, and some children that have very, very serious seizures actually have abnormal sodium channels, and that's causing electrical issues in the brain, and that's causing the seizures. And once you know that, then there's the possibility of actually developing some kind of medication with that as a target to hopefully help these children. So I was very excited to learn about this. This is a new development because it made many, many days in biochemistry class suddenly seem almost worthwhile, that there was actually some value to learning about sodium channels. Have any of you studied about sodium channels? No one? Okay, well, yes, you have, right? And it's pointless, right? I mean, so, but actually it does come into play later.